This is the case of total anomalous pulmonary venous connection through coronary sinus. This is subcostal view, and this is right atrium, this is left atrium, this is ostium secundum ASD. Flow is from right to left. You cannot see because it's not color Doppler. This is coronary sinus taking all the blood from pulmonary veins and draining directly into right atrium. The next image, you see this is, in this image, this is right atrium, and this is all pulmonary veins joining coronary sinus. This is coronary sinus. This is coronary sinus. Now the next image. Now this image, what you see. This is this is right atrium. This is left atrium, and this portion is ostium secundum ASD. Now the moving image, this is ASD. So in this image, this is right atrium, RA, this is LA, this is LV, and this is right ventricle, so RV, and this portion is pulmonary venous confluence. So this is pulmonary venous confluence. So if you, this is subcostal view, so right ventricle, right atrium, left ventricle, left atrium. This is inferior part, this is superior part. So superior to left atrium, you find pulmonary venous confluence. Pulmonary venous confluence. Now the next image, you can see this is ostium secundum ASD. So this is ostium secundum ASD. So this is right atrium, and this is left atrium, and this portion is ASD, ostium secundum ASD, and this is pulmonary venous confluence. Next image, same thing. This is apical four-chamber view. You can find out tricuspid resistance jet and trivial mitral resistance jet. This is TR jet, and this is MR jet. So this is left ventricle, this is left atrium, this is right ventricle, this is right atrium. Apical four-chamber view, basically right ventricle oriented. Probe is slightly right side, so right ventricle comes in the middle of the image, center of the image. This is PDA, patent ductus arteriosus. You can see this is PDA. This abnormal jet is PDA. This is right ventricle, this is main pulmonary artery, and this is PDA. You see, this is PDA. So here the mixing of blood happens through ostium secundum ASD and PDA. Next image, this is parasternal short axis view. Left ventricle chamber is D-shaped. This is very interesting view. You see this view. So again, this is right atrium, this is left atrium, and this is pulmonary venous confluence, PVC, and this pulmonary venous confluence joins coronary sinus adjoining into right atrium. So this is total anomalous vulnar connection through coronary sinus. So this is apical four-chamber view. This is right ventricle, and this is left ventricle. So anatomy is quite clear. This is apical four-chamber view. So any structure, if you find two chambers, one above another, left any chamber that is superior to left atrium, most likely scenario is pulmonary venous confluence. You can see the moving image. Moving image by image, you see Now just delete this one. This one is coronary sinus in this image. So pulmonary venous confluence draining into coronary sinus into right atrium. So that is the scenario. Coronary sinus. Very interesting. This is very interesting case. So you see what you see. Like you see in this image, this is right ventricle, this is right atrium, this is left atrium, this is left ventricle, and this is pulmonary venous confluence. This pulmonary venous confluence joins coronary sinus. You can see the coronary sinus is very much dilated. You see, this is coronary sinus. This whole length is coronary sinus. This is whole coronary sinus, almost 10 millimeter coronary sinus. So dilated coronary sinus, all pulmonary venous confluence joins coronary sinus. Right atrium, right ventricle, large oxygen saturation is poor. The case is total anomalous pulmonary venous connection through coronary sinus, and mixing happens through ostium secundum ASD and patent ductus arteriosus. That is responsible for mixing. You can see from right atrium to left atrium, that is right to left sided flow, and from PDA from left to right sided flow, from aorta to pulmonary artery. So in this way mixing happens. For mixing what? Right sided chamber should give some amount of blood to left sided chamber. Again, left sided chamber has to give some amount of blood to right sided chamber. That will cause proper mixing. So in this case, proper mixing happens through ostium secundum ASD, through right to left, and through PDA from left to right. So that is the scenario. If there is only one thing present, suppose PDA or ASD, only one, then it has to be bidirectional to force arrival. So that is the point to know. This case is quite interesting. So quite interesting. Whenever you find two chambers, clearly you find two chambers. So whenever you find two chambers, one chamber superior to left atrium, that is usually pulmonary venous confluence, and case is total anomalous pulmonary venous connection. Thank you.